Okay, so welcome to practice case number 4, where we're going to introduce a new technique here where we do sort of two phases of treatment within one treatment or one treatment plan. So what I mean by that is, first phase is going to be to expand and make room for the central incisor, and then the second phase is going to be to then advance the space that we've created. Okay, so, and this is just applies to a lot of cases. So first step is going to be to click on Add Setup, and then we're going to go in and we're going to use the staging tool, and we're going to take this entire segment here, and I am going to distalize that, and I'm going to be aggressive with this. Okay, we're going to distalize this, do some facial expansion. And then I'm going to do the same thing over here. And I am going to distalize this. And again, when I say distalize, this is not going to happen clinically. This is just about developing the arch, okay? There'll be some distalization, mostly anterior movement of the anterior teeth is going to happen. I'm going to do some facial expansion here, and this is just really about developing the arch more than anything else. Okay. Now I'm going to also just take this tooth and I'm going to just scoot it over a little bit, and I'm exaggerating some of these things a little bit here just for demonstration purposes. Okay, but the whole idea is, for the first portion of the patient's treatment, is going to be to make room for those teeth that are blocked out. Okay? So now I'm going to click on OK. And we're now calculating the distance of the tooth movement as well as morphing the gingiva. Okay? And we're going to, again, you have to, on the software, click back to 0 and then back to 1, and that's going to highlight the tooth movement, or the teeth that have the highest displacement. If you're curious, that's going to be this upper right canine here has the largest displacement. I know that tooth is rotated, and obviously you can unrotate that if you want. Definitely an attachment, but just for the demonstration purposes, I wanted to introduce how to sort of do the two phases of treatment within one treatment plan. First phase, again, was to make room for these the two anterior teeth here. So what we're going to do now is we're going to break up these tooth movements so far into intervals. Our largest displacement is the 1.8 millimeters of mesial or distal tooth movement. So we're going to divide that by 0.3. And that's going to give us roughly 6. So we're going to go ahead and do a create interval and click on OK. Okay, so now we have, just to review here, we have our first 6 setups, okay, really about just arch development and making room to advance those teeth that are locked in. Now, the second phase of the treatment is going to be to bring those teeth forward. So all we're going to do now is click on Add Setup. So now we're in setup number 7, and then we're going to click on the staging tool, bring this tooth forward into the ideal position. Shrink this down so it's a little bit easier for me to visualize. Do a little bit of rotation here, some rotation here, a little more advancement, some torque, advance, and we're going to do some And that's kind of a funny shaped lateral incisor there. I'm going to do a little bit of rotation and some torque. And now we're going to look from the facial perspective to see if there's any tooth movement that needs to be done. That tooth could probably use some tipping. Okay, so now we are going to click on OK. And so now the software has given us some new values here, and now we're going to go in and using these new values, we're going to create a whole new separate set of intervals. Okay, so we're going to click on Create Interval, and it looks like our largest interval is probably the 20 degrees of rotation. We've got 10 degrees of tipping. So I'm going to go ahead and add another 10 intervals here. And then click on OK. And then let the software run through its calculations. Okay, so now we have essentially two sort of stages of treatment. Okay, the first stage, so starting at 0, so setups 1 through I think it was 6 is really just about expansion. Okay, so we have up to 6 is really about expansion, and then 7 through the rest is about advancing those anterior teeth into the space that we made and detailing the final tooth positions. Okay, so again, just to show you a new technique on how to stage the treatment, so accomplish a certain series of goals for the first portion of the patient's treatment, and then accomplish a separate set of goals in the patient's treatment by using the Add Setup and then the Create Intervals feature. So you can really accomplish an unlimited or an infinite number of different sort of treatment goals by staging the goals or several goals within the overall patient's treatment plan. Okay? Hopefully that makes sense, and looks forward to seeing you in the next video.